Hi, Dr. Sasse here from the Continence Center at Sasse Surgical in Nevada. There's some very interesting research that was published recently about people who have had surgery in the pelvis, perineum, and anorectal surgery that was of a complex nature, and who then were experiencing loss of control of the bowels and bladder, so incontinence following complex surgery. And the point of the study was that sacral neuromodulation, the placement of this little chip gizmo computer with gentle current then restoring the pelvic floor motor response and sphincter response, had resulted in success to the point where a large fraction of those individuals were able to avoid a colostomy or colostomy bag creation. This might sound pretty extreme, but I think it's a really good example that helps us kind of understand the technology as it applies to more people. Because if it can work in this subgroup of the most seriously affected people who've had complex surgery, restorative surgery, and it can help restore their bowel and bladder function and restore continence, then it helps us understand why it works so effectively for the rest of us who don't have those more severe underlying problems. So most of the surgery that was done in this study was for cancer, usually rectal cancer. There was often radiation to the pelvis. And so those tissues, including the nerves and muscles, have been severely damaged. In many cases, in years past, we would have concluded that they were so severely damaged that we had no choice but to create a colostomy. And the colostomy is the placement of the bowel, bringing the colon out to the abdominal wall, and an appliance or sort of an adhesive is there, and a bag collects the waste. And so it's something that no one chooses to have. Actually, once people have learned to live with it, many people report that they have a very good quality of life. So I don't want to say that it's not a solution that can provide good quality of life for many people for many, many, many years, especially if what they're dealing with is even worse, which is a loss of control with incontinence and wearing diapers and having terrible problems from that. However, if we could have restored continence and not have to have the colostomy, everyone would choose that. And so this is really a giant benefit of sacral neuromodulation technology, that it's able to save that colostomy surgery for those people in that narrow group who've had complex anorectal surgery. And how it does this is by a computerized delivery of current. And so think of a cardiac pacemaker, but within this very small little miniaturized computer, basically, is algorithmic delivery of current through a complex lead that has multiple contact points on it. And it goes down through our tailbone. There's some natural canals there, so this lead goes through the natural canal in our tailbone to the nerve plexus. So it's not the spinal cord, but it's down below the spinal cord where all those nerves fan out in what's called the sacral plexus. And so by very carefully placing it in the plexus, which is my job at the time of the procedure, and using X-ray guidance and feedback from the person's body, then it stays in place because it has some little flanges or little kind of plastic hooks. I guess they're not really hooks, but little pieces that keep it from moving by embedding it in the tissues. It then stays put such that that computer can deliver this gentle current, but with a sophisticated algorithm, so that it restores the natural sphincter control and the normal activity of emptying and releasing and closing of the rectum and the sphincters. And that magic is what restores control, and it makes a huge difference to the individual, so they are no longer having to clean up accidents, wear diapers, wear pads, and suffer all of the frustrations and embarrassments and clothing changes of incontinence. And this system works whether it is for the bowel control or whether it is for the bladder control. In both cases, that same plexus of nerves will talk to and help regulate the muscles of the sphincters that are forward in the bladder neck and more posterior or backward around the rectum. All of that pelvic floor musculature has very similar crossover innervation, and that's why this system works for both systems together and has such good effectiveness. So I thought this study was very illuminating, that it had worked so well that it had allowed surgeons to avoid colostomies. And as a colorectal surgeon who does at times need to create colostomies, I welcome this technology that may allow us to have fewer people requiring colostomies going forward and more people who will have satisfactory control because of this very non-invasive technology that that just restores our body's own mechanisms without surgeons having to go and do much work there. It's the kind of procedure that might take half an hour and you walk out of the surgery center with a couple of Band-Aids. It's not something that requires recovery time like surgery. It's more like a minor procedure. Well, I hope that's been helpful in reviewing that recently published study, and I hope that if you or someone you love is suffering with bowel or bladder control problems, learn more. It's something that's kind of a best kept secret. Like many things, there's big pharma drug companies with enormous budgets to promote pharmaceutical solutions for problems even though the drugs don't work very well. And this technology works exceedingly well, but there really is no big, advocacy industry that's promoting it with giant deep pockets. So if someone you know or love is suffering with this problem, learn more. You can certainly read articles on my blog at Sasse Surgical, and there are many other good sources of information out there today that describe more about the success of sacral neuromodulation. All right, I hope that's been helpful, and I wish you the best of health.